speak to all of you about stress and burnout. So just to put this into context, I had run a workshop at the recently concluded Singapore Mindfulness Conference, which was primarily directed at other doctors and healthcare workers. This talk has been adapted from that. So I just want to emphasize a lot of the things I'm speaking about are equally applicable to not just healthcare workers, but everyone. Okay, so I'm happy to take any questions, probably best left till the end of the talk. So, why am I not moving? Okay, there we go. So the objective of today's session is to describe and define what burnout is and its relation to stress, describe the symptoms, consequences, and risk factors of stress and burnout, recognize its warning signs, and I'll give you a brief introduction to the interventions for stress and burnout. So I'll just tell you a little bit about myself. I think Angie had already introduced me. I'm a pediatrician in KK Hospital. I'm also a program director for the Singhealth Paediatrics Residency programs, which means I'm in charge of the training of pediatricians in the making. And my own interest in burnout came up when I attended a couple of international conferences, especially in North America. And I had attended one or two of these sessions. And I then realized I thought I was attending it for my trainees, but as the program went along, I actually realized a lot of the stuff was actually extremely applicable to myself as well and my fellow senior colleagues. Again, just to reiterate, I will go through a brief literature review. They may appear to be heavy in terms of healthcare worker related publications, but again, it's whatever I say will be applicable to everyone. So if all of you would like to just log in to on your mobile devices on polev.com, and I just want to do a survey to get a feel of my audience today. So if you go to polev.com, under the username, you can put my name, RAVSHAHDADPURI. It's a totally anonymous. You can choose not to put in your username. And in fact, I think I just want to get a feel of our audience today. So I'll move on to our first activity. So again, I was just trying to find out the audience I had today. There's more than 100 people logged in today. So again, the response for this poll EV is you can answer more than once. So for example, how would I describe myself? I'm a doctor, but I am also a teacher because I'm in charge of training of the residents. And quite a number of times I also feel like an administrator. So I fall in a couple of different categories. So again, feel free. This is an open text response. Banking. Okay, so we have quite a varied field: banking, finance, social worker, engineering, peds physio, educator. Okay, nursing, finance, engineering, a couple of nurses, we have a couple of educators, coach. So I think being an educator, I think we could be a lot of things. If you're in finance, banking, nursing, a lot of times we could be mentors or preceptors. So we could be educators in those particular fields as well. Okay, move on. Again, thank you for those who responded. So I think we have quite a nice varied audience today. Teacher, psychologist. Okay, so I'll just move on. So again, so my question to you is, why are you attending this particular session today? So when you saw the topic on the Graham Center website, how to reduce stress and burnout, were you attending mainly for yourself? Is it for your colleagues and peers whom you think are quite stressed, whom you think you can help? Is it for your junior trainees? Is it for your family members, your siblings, your parents, even your kids? Or is it a bit of everything? Okay. So, for those who have responded so far, the vast majority, three quarters, are here for themselves, and again, about 20%, nearly a quarter, are here for all of the above. Okay, that's good to know because a lot of the things I'm going to be talking about today would be something you can use for yourself and very much so for your colleagues at work, your trainees, your family members. And I know when I attend a lot of these sessions, sometimes at mindfulness meetings, it's quite often it's for all the above reasons. Okay, thank you for your response. So again, I just want to go straight into burnout. So what is burnout? I will go into the definition of burnout soon, but burnout was described by the World Health Organization in May 2019 as an occupational phenomenon, which happens primarily around the scope of work, which personally I would not necessarily agree with because I think many of you may agree with me that sometimes you can get burnt out not so much just from the workplace, but also in your personal lives, your home situation, relationship issues. So, workplace stress is one domain, but not the only one. And in fact, in ICD 11, so for the medics out there, ICD is the International Classification of Diseases. So we are in our 11th edition now. ICD 11 also describes burnout as an occupational phenomenon. And it's not described as a medical condition, and it's primarily due to workplace stress, and it happens during an occupational context. And it should not be applied to describe experiences in other areas of life. Again, ICD 11 and WHO say it's purely an occupational phenomenon. Again, this is something I would respectfully not necessarily agree with because I feel many other areas in our lives can contribute to burnout. So, in terms of the definition of burnout, burnout, as we know currently, the term was first coined by Freudenberger. Freudenberger was a Jewish psychologist based in Manhattan, New York. He was a survivor of the Nazi World War II Holocaust. He was a concentration camp survivor. And he described burnout as the extinction of motivation or incentive, especially where one's devotion to a cause or relationship fails to produce the desired results. In more recent times, I suppose in the last 30 to 40 years, the burnout, when we talk about burnout, it's the definition which was coined by Maslach, who is a psychologist. And Maslach many of you may have come across the term Maslach because she came up with the MBI, which is the Maslach Burnout Inventory, which is the current concept of burnout we use now. And it's essentially a syndrome triad consisting of emotional exhaustion, which is a chronic state of physical and emotional fatigue resulting from excessive professional and personal demands, depersonalization or dehumanization, where you get a set of callous and insensitive behaviors or feelings towards your patients, your co-workers, and even yourself, and family members even, and ineffectiveness where you get a decreased sense of personal accomplishments. So again, stress and burnout, it is not really black and white. It's different shades of gray. It's a spectrum. So this is a very nice review paper in the Annual Review of Psychology by Maslach. And it was described as what started out as important, meaningful, and challenging work becomes unfulfilling and meaningless. So again, as I mentioned, it's a spectrum. When you start out with resilient behavior, which then goes to stress, ultimately ends up with burnout. So energy becomes exhaustion, compassion may become cynicism, and efficacy will then, at the extreme, become ineffectiveness. And again, just to remind you, stress is good. A bit of stress is good, which I'll talk about in a little while. Stress is sometimes it's when you're over-engaged, when emotions are overactive, and your demeanor is one of anxiety and hyperactivity. And so you're engaged, and if you're over engaged, you get stressed. And once you get burnt out, you're disengaged when your emotions are blunted and your demeanor is one of depression, detachment, helplessness, and hopelessness. So this is quite a famous graph. It's the Yerkes-Dodson law. Essentially, on the extreme left hand, if you're totally not stressed, your performance is poor. On the extreme right hand corner, you're extremely aroused or stressed and your performance might decline. So I think what all of us, regardless of occupation, we do is we want the optimal amount of stress where you hit your peak performance. Because we all know if you're not motivated and not stressed, we tend to be a bit more, I suppose, lack of a better word, chillaxed, or take our time. But sometimes you need to be under a bit of pressure to get the optimal level of performance. And again, this is just another representation of the previous graph. We are trying to aim for the normal, the middle of the bell curve. To the extreme left, you're inactive, you're bored, you may lack. To the other extreme, it can lead to anxiety, anger, exhaustion, and burnout. So for all of us, is to try to hit I suppose, the happy medium. So this is the Maslow burnout inventory, which I had mentioned previously. So most the burnout studies would use the NBI. It's a 22-item survey, which goes through the three pillars of the triad: emotional exhaustion, depersonalization, and personal accomplishment. So again, you can just look at some of the questions. I feel emotionally drained from my work. I feel burnt out from my job. I'm frustrated. In terms of depersonalization, accomplishments? Do you feel you're not relaxed at work? So, if I could get all of you to spend maybe a couple of minutes on this is a abbreviated burnout self-assessment. So you can either go to the website there, or if you have your phone on you, just use your QR code reader, go on to Mind Tools, and answer the 15 questions. It burnout studies would use this to decide whether people are at risk of burnout or not. So again, it's the three main symptoms over the syndrome triads of emotional exhaustion, depersonalization, and personal accomplishments. And then what I was saying is the Mind Tools is a abbreviated MBI, and it's free. And again, I think it gives us a good indicator of where we are all at the moment. And again, these things change. They are not set in stone. You could do this when you're in a particularly low period in your life and be at significant risk of burnout. You could do it subsequently and things could get better, or if you're more stressed, get worse. So just remember, this is just a snapshot in time. And these are the questions from the Mind Tools assessment. And this is the score interpretation for those of you who have done it. So 15 to 18, you have no signs of burnout. 19 to 32, there's little signs of burnout, unless some factors are severe. 32 to 49, you may be at risk of burnout. 50 to 59, you're at severe risk of burnout, and 60 and to 75, you're at severe risk. So, looking at your own survey and your scores, my question is, were you surprised by these results? Yeah, so I think this is important. I mean, when I first did one of these surveys, I thought I was totally fine, doing well. And I think when I actually answered some of these questions quite honestly, I actually even found myself at that particular time that I was at risk of significant burnout. So for me, when you're not really attuned to what burnout is and what the risk factors are, it becomes a shock. I think now that it's gained a lot of press, some of you may realize, yeah, I think I'm at risk, and sure enough, the survey shows that I am. Okay, so of those of you who have answered the survey, 80% of you came as a surprise, but one-fifth of you felt it was quite expected. I beg your pardon, let me rephrase that. Only one fifth of you was surprised that you were burnt out. And 80% of you, even before doing the survey, you sort of realize, yeah, I'm at risk of burnout. So looks like a lot of the audience have already some insight into about your, I suppose, levels of stress and risk of burnout. Okay, so actually it's the minority for those who are surprised. Okay, so the symptoms of burnout, and again, when we talk about burnout and stress, we go over the three main symptoms within the triad of exhaustion, depersonalization, and ineffectiveness. So in terms of emotional exhaustion, you lose your enthusiasm for work. You dread going to work. Mondays are probably especially hard to get the day started. You feel tired all the time. You want to work less. In terms of depersonalization, you can get cynical, you get sarcastic with your friends and colleagues. Sometimes you feel that work is the problem. You can get angry with your clients or customers, patients for myself. You get irritable with your colleagues and you get detached from your work. And in terms of ineffectiveness, you feel you're not accomplishing much, you're feeling unproductive, you're not satisfied with your work, and sometimes you even worry about getting disciplined or fired from your job, and you don't find value in what you're doing. And these are the consequences of the burnout in terms of the three pillars of the triad. In terms of exhaustion, emotional exhaustion, you work less. It may lead to early resignation in the extreme cases. You can have poor physical and mental health. In terms of depersonalization, you're less satisfied with work. You may get increased customer or client complaints. Your standard of work might deteriorate. In terms of ineffectiveness, you put out lower quality of work. Your job performance is less, and there's increased levels of errors in your work output. And again, why bother talking about stress and burnout? So there are a couple of facets to it. You can talk about from your own personal perspective and organizational perspective, if you're the boss or HR. So in terms of your job performance, it affects your patient or healthcare workers or customer care if you're in other careers. It can lead to absenteeism and low morale, professionalism, decreased satisfaction, deterioration in the quality you produce, and increased occupational errors, be it medical and adverse outcomes. In terms of personal decision, you're exhausted all the time. You can become insomniac. You can suffer from insomnia. Can lead to marital and family problems, substance abuse, depression, and in the extreme cases, suicide. And why all these consequences? So in terms of the personal health effects, again, this applies to all of us. And stress affects our IHPA, which is the hypothalamic pituitary adrenal axis. So this is our parasympathetic and sympathetic nervous system, the so-called fight or flight response. When you're stressed, your adrenal glands squeeze out all the adrenaline, which was probably good when we were cavemen escaping from predators, but not so much now. And all these constant levels of high stress will increase your risk of depression, other mood disorders, cancers, digestive problems, especially things like ulcers and bowel syndrome, eating disorders, heart disease, stroke, sleep problems, drug and alcohol abuse, relationship stress, and again, as I mentioned previously, suicide. And in terms of effect on patient care, and again, for the non-medics in the audience, you can substitute patient with your customer care or client care. There's deterioration in quality that you provide. It can lead to increased occupational errors, medical errors, and lower patient and customer satisfaction scores. And also for many of us, reduced job performance, increased absenteeism, professionalism lapses, and reduced job satisfaction. And in terms of the effect on the more macro level, for me, it could be the healthcare system, but for you, if you're working in a big multinational or even a small medium enterprise, it can affect your company, your parent company. There'll be increased staff, there'll be reduced staff productivity, there'll be increased staff turnover, and all this could result in increased operational costs. So just shifting our focus briefly on healthcare workers, especially doctors, because this was what my original talk was about. So physicians struggle with one of the highest rates of suicide among any profession. And in the US, a doctor dies by suicide every day, which is quite a scary statistic. This is an excellent paper on burnout in JAMA, which is the Journal of the American Medical Association. So this looked at 47 studies covering 42,000 doctors, looking at physician burnout and its other risk factors. And essentially, it was associated with an increased risk of patient safety incidents, poorer quality of care, and reduced patient satisfaction. And in particular, those who were residents, or basically residents are early career doctors who are training, especially less than 5 years after graduation. And this was an article which was in the Straits Times in 2014. And there was a survey done by the Singapore Human Resources Institute, the SHRI, surveying Singapore workers, the so-called happiness survey. And if you look there on the extreme right, the happiness index, 68 to 100, you're happy. 51 to 67, you're underhappy. 0 to 50, you're unhappy. So if you can look at where your occupation is, so basically, if you're less than 68, you are underhappy or unhappy. And yeah, if you look at the scores for a lot of fields there, Singaporeans are a whole lot of unhappy people. So again, this is quite worrying. And in terms of stress and burnout, right? So what are the factors associated with stress and burnout? If you by nature are a pessimistic person, if you have regret over your career, if you're a perfectionistic person, if you don't spend enough time looking after yourself, not enough time for self-care, lack of coping skills, poor relationship with your colleagues, peers, and support, lack of support structures, and poor personal habits, including substance abuse, be it alcohol, drugs. And how big is burnout an issue, or is it just a trendy topic? So, in particular for healthcare workers, the T.H. Chian Harvard School of Public Health in January 2019 called physician burnout a public health crisis because the issue was huge. And again, it's not an American thing or a Western thing. It respects no boundaries in terms of geography or seniority. So again, the Lancet had described physician burnout as a global crisis in an editorial of July 2019. And it went through a couple of case studies covering multiple incidents over multiple countries: China, Canada, Australia, the US. And how about Singapore? So there was a study done in 2012 in the Annals of the Academy of Medicine, which was a health-related quality of life survey in junior doctors in Singapore. And their hypothesis was that junior doctors experience high amount of work-related stress and fatigue. And the results did show that junior doctors in Singapore had poorer mental health scores compared to more senior doctors. They were more likely to show signs of anxiety and depression. They perceived themselves to be of poorer health, and they felt more worn out. This is another study done in Singhealth, done by one of my colleagues, and they've been doing an annual survey since 2015, and the rates of burnout have sort of gone down and then up. So burnout was at a peak of 81 to 55, and it went up to 65. 9% of the doctors surveyed screened positive for suicidal ideation. 13.4% for depression, which was higher than the national average of 5%, and 56% described having good quality sleep, which means 44 did not, and significant increase in the levels of empathy, which is quite encouraging. And in terms of seniority, again, it just doesn't affect the junior doctors and trainees. So again, a couple of senior doctors, there was a case of an anesthetist in the UK who was found dead in the operating theater. But unfortunately, anesthetists, especially anesthetists among all doctors, had access to a lot of very lethal anesthetic drugs. So this doctor committed suicide within the operating theater of his hospital. And this was another anesthetist who killed himself with drugs which he pilfered from the hospital. And again, It's not a Western thing. This was a case which was happened in 2017, but was reported in September 2019, where a doctor in Tanting basically took illegal drugs related to work. And this is especially quite concerning. So Greg Els, he is the head of counseling and psychological services in the University of Pennsylvania. So he ran the service which looked after faculty and staff who had stress, burnout, suicidal concerns, and he himself jumped off his office block, which I think a lot of people in the mental wellness community were utterly shocked at this development. And just when you thought things were not over, just when we were thinking things were settling down, then coronavirus happened. And again, the toll of mental health by coronavirus cannot be underestimated. There's been a lot of information emerging in the medical literature. Again, it affects all people from all walks of life. No one is spared. And healthcare workers are disproportionately affected. And this was a case of Lorna Breen, who was a consultant physician in a New York emergency department. And because they were so poorly equipped, overwhelmed, with not much support, that she basically had to take some time off work. She recognized that she had burnout. She took some time off work, went back to the family home in Virginia, and committed suicide at home, which was again very shocking to many of her colleagues. Some of the issues which helped to help to explain why doctors were at this position was because of the increased demands made of doctors and healthcare workers and the pressure to endure these demands. Again, there have been many studies done, which for the scope of this talk I have omitted. Just to highlight a few things, this was a nice editorial in the Occupational Medicine Journal on physician suicide and the COVID-19 epidemic. And basically, what is already a challenging healthcare environment is made more challenging during the pandemic. To be fair, I worked at a healthcare institution. There's never been any time I felt I didn't have access to N95 mask or personal protective equipment. There was never an issue. ICU beds, nothing like that. I can tell you, I have colleagues who work in Boston, New York, the UK. For them, it's a constant fear. If my patient gets sick, I have no ICU bed to ventilate them. What do I do? So you're playing God, because the decision you make will decide the patient's fate. And that's what they talk about, moral injury from ethical dilemmas. And again, this is an excellent review article in the New England Journal of Medicine entitled Mental Health in the COVID-19 Pandemic. This was just published in August of 2020. And again, they talked about a huge impact of COVID-19 to the entire population. Again, they go into detail about the disproportionate effect on healthcare workers. And essentially, again, similar risk factors. They're at risk of the virus. They are concerned about getting infected and passing it on to their loved ones. And again, lack of access to PPE, longer working hours, and working in ethically and emotionally fraught, resource deprived situations. Which again, to be fair, in Singapore, we've never been in that issue. I can speak with quite confidence in all the public and private healthcare institutions in Singapore. We're quite well prepared. So what's very important, and I want to emphasize this, is providing self-care for the providers. So including mental health care providers to inform them about the illness, risk, monitoring your own stress reactions, and seeking assistance when appropriate, including professional mental health intervention. I think this is very, very important. So the first step is to recognize it. You need to recognize it in yourself, and you need to recognize it in others to help them. So this was a letter to the editor in the Emergency Medicine News talking about the physician suicide epidemic. And I think one of the meta messages was, again, they say physician here, but I think that can be maybe extrapolated to many of us. No physician or person who is suffering will want to readily admit it to friends, family, or colleagues. And essentially, as individuals, if you hear, feel, suspect, or worry that a fellow physician, colleague, work member are at risk of burnout, chances are you are right. So say something, reach out to them, talk to them, accompany them to seek help. So essentially, I think there's a lot more publicity about mental health awareness. There have been a lot of articles in the popular press about people having mental health issues, and they've actually come up and sought help, and they've actually come to the press to make known their story, which are all actually excellent things. But there'll still be, I suspect, these are the vocal minority. I think there's still a lot of people suffering in silence. So they need to seek help, and if you're a friend, colleague, family member, to recognize it and help them seek help. So what are the warning signs of stress? Warning signs of stress and burnout. So having trouble sleeping or excessive sleeping sometimes, having trouble eating, appetite changes, loss in interest in activities which you previously enjoyed, having persistent pains, feeling exhausted all the time, falling sick often, feeling anxious, irritable, restless, getting disillusionment with work and life, a sense of cynicism, poor concentration, and then using food, drugs, alcohol to feel better or to sometimes numb the feeling of emptiness. So there is help available. Okay, so I think it's very important to be aware of that. So first, I wanted to discuss what are the factors which is associated with wellness. So again, it's quite personal. Different people prefer different things, but these are all evidence-based. So the use of meditation, relaxation, massage, or other therapies. If you, as a person, baseline feel that your life is under control and you are have a feeling of connectedness or compassion to your patient, colleague, job, if you have good strategies for coping and coping skills, you're able to talk about your feelings with others, having a plan for the future, and very importantly, having a supportive work environment. So the next section of my talk, I'll be talking about strategies to promote wellness, increase resilience, and to help to try to reduce burnout and reduce stress and combat burnout. So again, there are two broad categories. Okay, so there are workplace driven interventions, be it workplace, structural, organizational. And these could be one of a number of things: stress reduction programs, mentoring programs, balance or focus groups, emotional intelligence training, and self wellness program. So again, I work in KK Hospital, and again, over the last couple of years, there's been an increasing recognition of these issues. So we've got initiatives happening within the KK level. Then we've got strategies happening at a more organizational level, at Singhealth level, and it's open to all members of staff to sign up. We've got art therapists who do art therapy sessions. We've got a psychologist who help talk staff members through mindfulness activities. So there's also a little initiatives by work to try to add, I suppose, what they call joy at work. Sometimes it's the little things which help. It could be anything from a free Starbucks voucher to staff members, which we get from time to time, to discounts. Again, this is all before the COVID-19 pandemic. Discounts at the Shaw cinemas for movie tickets, and up till recently, they had like a little lottery for hotel rooms by Pan Pacific, which were open to all staff members. And then next, I want to talk about individually driven interventions. Again, these could be behavioral, social, or physical activities. And again, this is not exhaustive, but these would include things like activities like meditation or mindfulness, physical exercise, having a peer support group, and also counseling services. So again, how do you manage stress? There are one in a number of ways. So again, this is something I tell and some of my colleagues. If you can't look after yourself, you can't do your job, and you can't look after others. So it's absolutely okay to acknowledge that you're tired. Okay, you're not Superman. We are all only human. Sleep hygiene is extremely important. So again, some of the advice we give is, at least aim for 7 to 8 hours of sleep. Try to have reduced screen time before sleep. Have a quiet, comfortable environment, and everything to go along with good sleep hygiene. If you're really tired in the middle of the day, short naps have been shown. There have been scientific evidence to show that short naps work, but ideally not more than 30 minutes before you go into deep REM sleep, and it should be before 3 p.m. So if you want to take short naps, there's a scientific way of doing of having short naps. Eat and hydrate, especially if you're doing a long work day or shift. And again, for those of you who do shift work or on call, don't pack your off days with chores. I know I'm guilty of that sometimes. I'm super busy at work, and sometimes on the weekend off, instead of resting, sometimes on my days off, I actually more busy because that's when I only get to do all my other work stuff like my banking stuff, my shopping. So you need to try to use your time off to do nothing sometimes. Okay. So again, when your work feels more like a love of labor than a labor of love, then you really need to take a step back and make a change. So again, regardless of what job you're doing or occupation, or I suppose for some of us in healthcare, maybe you could want to call it a calling, think about and why you wanted to do what you do. Again, find strategies which recharge your batteries daily. It's important to keep healthy, so eat well, exercise. You need to hydrate yourself. I know it sounds like it's very basic, simplistic advice, but I think many of us don't even practice this, and I have to constantly remind myself to do it as well. It's extremely important to learn to prioritize your tasks. What has to be done today, what has to be done by the end of the week, what is nice to do, but the earth is not going to stop if I don't do it. So that's very, very important. And again, some of the personal things is practice gratitude. You can keep a journal or what we call the three good things. I just named three good things which happened today. You woke up rested. You read a good book. You went to you went out and somebody complimented you. It can be something very, very, very simple. And I keep saying it to some of my friends and colleagues. No matter how bad you think your day is, we are better off than 80% of the population. Most of us have food to eat, we've got roof over our head, we've got clothes to wear. So just by those three things, you've got food, you've got shelter, and you don't have to worry where your next meal is coming from. You're already better off than half the world's population. And you have to sometimes remind yourself of that. And again, there are other strategies, right? Like mindfulness, be it zooming in into a activity like this today to find out what's going on, taking part in some of the BRAM Center activities. There are a lot of excellent apps out there online. For example, Headspace is just one of many. And if you're tired, do not blame yourself. As I said, it's normal to be tired. Don't necessarily work harder and longer because your productivity will drop. Do not self-medicate. Turn to alcohol or drugs. Having a social drink with your friends on a weekend or weekday is fine, but using that as a primary use to escape is not a good idea. And again, many of us I know feel guilty when we take time out to spend for yourself, to read a book, to go for a walk or a jog at the beach, thinking, oh my God, I've got so many other things to do for so many other people. Looking after yourself is not a guilty pleasure, it's a necessity. So again, ideally, if you have somebody you can talk to or confide with, that's excellent. You have to understand that stress and fatigue is a normal part of life. Exercising and eating properly, this is something, again, I have to remind myself, I quite regularly skip meals. If I'm tired, I won't go for a run this morning because I'm tired. But again, you have to make it part of your routine. I'm by no means perfect, but I'm trying very hard. Getting enough sleep, which is something I'm also striving to do myself. Again, like I said, I mentioned earlier, take time off to recharge your batteries. Your rest is not a luxury, it's a necessity. And it helps to develop interests outside work, be it voluntary charity work, playing music if you're playing a musical instrument, being part of just pick your passion and do it. And again, it's important to do what you like. It's important to find something you identify as important and to pursue it. And again, you say yes, you are asked to do a lot of things. So say yes to what you want to do and say no to those which are less important. So again, Angie asked me to do this quite a while ago. Uh, are my weekends important to rest? Yes. But again, stress and burnout and mindfulness is a topic very close to my heart. So this is something I said yes to happily. But I would probably have said no to a lot of other things, to a lot of other people. So again, you have to pick what you have to say yes to. So, in a nutshell, sometimes you have to put yourself, not sometimes, you have to prioritize yourself quite often to recover from burnout. Okay? So, when I say practice psychological detachment, again, set your phone or work related activities aside and don't think about work. I do not check my work emails once I leave work. I'm at work 7:30, I leave work at 7. After that, I do not check my work email. So all my colleagues know if they send me an email at 7:45 in the evening, it will not get read to the next morning. Obviously, if it's due to a patient or I'm on call, they know to call me, WhatsApp me, but I won't check my email because if I'm checking my email at all hours, I will not get any rest. Relaxation, again, choose what is important to you. Again, for example, I used to read ebooks on my laptop or my phone, but then again, your laptop and phone have internet and you're looking at all sorts of rubbish emails and you go down a rabbit hole of the internet. So I actually got myself like an e-reader. Kobo is an equivalent of like a Kindle. So I read my book and there's nothing else. It's only, I can only read books on it, which suits me perfectly. And number three is practice mastery in a thing you enjoy, be it a musical instrument, a sport. So I used to play guitar when I was in university. I've recently tried to start again. Am I good? I'm horrible, but it's sitting out there. I take it out, I strum along. Again, it gives me something to do. And choose how you spend your time and choose doing something you enjoy. Okay, so that concludes my talk. I am okay. I made pretty good time, 3:45. So I will end there. This is my last slide. So I'm happy to take any questions or again, feel free to unmute yourself and ask